We really like working with clients who want to meet their purpose, grow their purpose in anything where marketing can add to people's quality of life, or as we say, marketing for good.
Welcome to the Marketing for Good podcast. Today we are joined by Dr Rik Dawson. Thanks for joining us, Rik.
Thank you for having me, Leah.
We'll start by acknowledging the traditional custodians and the lands in which we are working and connecting today. We have the Gadigal people of the Aurora Nation, and we have the Darkajong people, where I am on the Central Coast, and we'll pay our respects to their elders, past, present, and emerging. Before we dive in, I thought I'd just give a little bio on you, Rik, to give our listeners some context. So Dr Rik Dawson is a geriatric physiotherapist, a researcher and entrepreneur with more than 20 years experience delivering falls prevention programs across community and residential aged care. He has successfully built and scaled physiotherapy businesses, giving him a unique insight into how healthcare research can be translated into practical, sustainable solutions. And I might just add there that, you're very successfully commercialised them as well. And as a postdoctoral researcher at the University of Sydney, he has developed the TopUp exercise program, exploring how online exercise videos can help older people maintain strength, balance, and independence. We were very fortunate here at Juntos Marketing to partner with Rik to help with the commercialisation of TopUp, and I'm really looking forward to diving into that a little bit more today. But I should also add that Rik is the National President of the Australian Physiotherapy Association, where he champions initiatives that advance physiotherapy practice, research, and business strategy nationwide. What a bio. Welcome, Rik. Great to have you here.
Well, it does suggest that I'm an older clinician, having done all those things, but I have found that developing meaningful clinical programs needs funding support, and that naturally led me into thinking about doing some advocacy for older people, because it's all very well for researchers to give clinicians and people solutions about their health, but they need to be able to fund these programs. And that's why I like having a co-joint position between the University of Sydney and the Australian Physio Association.
No, that's a really good point to kick us off on. I wonder if you could tell our listeners a little bit about you, your roles, and what sits at the heart of the work that you do.
I'm just really passionate about helping people have their best health. And because once they've got their best health, they have their best lives that they want to lead. And I've predominantly worked with older people, and having conversations around what's important to somebody is a really great motivational conversation, because sometimes when we say, let's just do these exercises, people go, oh, that's a bit boring. And I go, but it's a means. Doing these exercises is going to take you the step in the right direction to achieve the things that you want to achieve, which is independence in the environment, getting to cafes, playing with their grandchildren. So I've always been passionate around trying to help people understand that exercise is a building block to help them build the life that they want. And the reason I went into research is working with older people is not as sexy as a physio working on the sports fields, and there needs to be more research so that we understand the best ways to support older people. So when I sold my business, my aged care business in 2019 into 2020, I just decided that, well, not enough people are doing aged care research. Maybe I could put my hand up and have a go at it.
Yeah, fantastic. And what you've described there is, an intersection of quite a few different areas. You've talked about your research, the healthcare delivery, and, professional leadership. Oh, and of course, business as well. So you talked about, aged care being one of your core passions. Is there a particular something you can reflect on? Is there a particular person that's influenced you, or a story that you can sort of think about that's led you into this space?
Look, I initially started in pediatrics, and I loved working with families to build programs that support their kids to thrive. And it's a very much multidisciplinary approach. We work with doctors and nurses and occupational therapists, speech therapists. And it requires a lot of conversation and dialogue and a bit of fun. And I then found myself working with some older people, and it's exactly the same approach. Older people have families and partners, and again, we work in a multidisciplinary team, which I really like, but again, it's dialogue rich. You know, I need to understand their complex stories. I need to understand their complex medical histories. I need to see where all this fits in with their complex health. And so I love having those conversations to an older person about what they want to achieve. I've got some skills and ideas for them about what they can do to achieve this. But I've always loved working within a care team. I really enjoyed the dynamic environment of a care team. Compare working in aged care, paediatrics, potentially say in private practice, musculoskeletal sports. It can be very much a person and their physio dialogue, which is super important. But I really just enjoyed the team approach to care, the holistic approach to working with other clinicians and the patient themselves to help them achieve the goals that they wanted to achieve. So I think it's just that dialogue-rich approach.
I love that. And you're working as a team, as you've touched on. So we might dive straight into TopUp exercise, the program. Can you explain what TopUp is and how it works in practice?
So TopUp is a website that's currently available, which stores a series of exercise videos. There's only 8 videos, and they start with a 10-minute exercise video based in a chair. And the whole video step a person through something simple and seated. So by the time they're half up to program 4, they're doing some standing exercises, and we start to improve and introduce more complex balance exercises in standing and in walking. We start to increase their weights so that they're building some muscle strength. It is based on a program designed in New Zealand called the Otago exercise program that's been around since the 1990s that showed a progressive balance and strength and walking program designed by older people for older people will reduce their risk of falling by about a third, which is really important. It's been around a long time. Physios understand it really well and use it a lot in their practice. So I wanted to create that program using videos because the challenge that we have in Australia, especially in my business that I used to run, I grew up out west New South Wales. I moved to Sydney to do my training. Met my wife who's a physio. I decided to stay in Sydney, but I was really wanting to work in regional areas where they didn't have physios that had potentially the skills with older people in residential aged care and home aged care. So we used to do all these fly-out clinics, which are really important, but then I might only see a person once every 2 or 3 months. And so what do they do in between times? I used to give them a piece of paper with some exercises scribbled on it, and then I'd come back in 2 or 3 months' time and they've lost the paper or never used it. So I started thinking, well, maybe we just need to develop some exercise videos, and they just hit play and they follow along. Now, COVID then hit and everybody went online, and telehealth has become a big part of many medical practitioners' toolkit, especially physios with exercise. So TopUp was originally designed to be form basis of my PhD, do these sort of digital health resources such as exercise videos, help people do quality exercise at home between visits. I also tested the ability to do assessments and treatments online using Zoom. So it was a 2-element project because in regional and remote, we just can't get out there quick enough. If somebody has a fall, they need a follow-up today, not in 6 weeks when I'm due back. So we added that element of the telehealth and it was successful. So TopUp came out of my PhD. We were fortunate to get our results published in the Medical Journal of Australia, which is one of Australia's leading healthcare journals, to show that it is effective, safe. Older people do like it. Telehealth is not for everybody, but for those who do want to use it or like it, it can deliver similar effects compared to face-to-face. So TopUp emerged out of that research, and we're going to talk a lot about co-design. How did we design TopUp? But co-design was right. It's been a big part of my practice. You know, when I was a sole clinician, I was trying to meet the needs of different nursing homes. What did they want? And they wanted more physios. I started employing physios. How do I support them to deliver evidence-based practice? So I was always having conversations with aged care managers, with nurses, with doctors, with physios who are working with me, with their patients, about how do we get a system of care that works for everybody. And co-design has been a friend of mine for a long time.
I love hearing that. So I want to talk about, how you have successfully commercialized, something that is for purpose. I think that is incredible. And it's not an easy thing to do by any means. And I feel like I was going to say, what's the secret? But, you've sort of touched on co-design quite a bit there too. And I wonder if that's been a key element of making it quite successful as well.
I think that when you run any commercial venture, you have to go in it with a win-win ideology. So clearly, if you want to run a business, you want it to be financially successful. And for that means you need repeat business. You have repeat business, it's about delivering a product or a service that somebody wants. So I did a lot of reading early on around the concepts of win-win, the Stephen Covey books, even lots of business books to help me understand that concept and really unpack it in a structured way. But, what does a person want from a care point of view? Where do they want it? How much do they want? So you've got to keep asking these questions. But when you work in a complex system like aged care and nursing homes and in community aged care, they're complex environments. There's lots of demands on people's time. And I mentioned before, we do work within a multidisciplinary care team. So I've got to consider how much time the person has, how much energy the person has, what other things that they need to do in their day, who are they seeing, what do they want, and create a program. So I know that we've got lots of guidelines around quality and safe care in Australia, which I'm really supportive of. We've got the aged care accreditation that now looks after residential and community aged care. We've got these government imposed rules and regulation, which are designed to support safe quality practice for everyone involved. So I need to make sure I take that into consideration. But you also got to remember, at every, what I call site, every residential aged care facility, they're unique. They've got their own unique needs and resources, or lack thereof. And so each site needed a tailored approach. And what do they need from me and my physios versus what we could offer from a realistic financial point of view. So conversation, dialogue, what do you want? How can I support you? And that you is many different people. So my commercial track record was designed by that win-win. And, you have to have honest conversations with staff and clients that a business needs to be financially sustainable. Otherwise, it goes out of business. So that has to be a part of the conversation too. And in health, I don't think we are as strong at talking about financial sustainability, but it's getting better.
What role did marketing play in the process?
Marketing for me, because I've been doing this for nearly 30 years, has always played a significant role. And I've engaged with designers from a graphic design point of view to make sure that, my business websites were appealing and simple to use. I've always been really making sure that whoever's using any of the resources, be it digital or print, that they serve a purpose, which is to get whatever education or exercise programs up and running. And so I informally connected with different marketing solutions throughout my clinical and business journey. But when I worked at the university, I had the opportunity to do a Sydney University commercialisation course. And marketing to me is really important to get your message out. and it's not my skill set. I suddenly realized I really needed to step up my marketing approach, and I was fortunate to get some money from the university to investigate marketing specifically to design this website that was the output of my PhD and my long clinical journey and all my learnings from both those clinical and research spaces. So for me, marketing is that final step in creating a product that is appealing. Because if somebody doesn't want to click on a button or open a book, you've got a barrier there. And so marketing, if it's inviting, if it's got a message or a look that matches or feels safe and embracing, I think it's really important. So I was really lucky to start working with Juntos in looking at how we could get a website that was not only simple to use, looks good, and leaves somebody with a positive feeling that when they engage with it, the actual design of the website is supporting them.
Yeah, I couldn't agree more. You said that very well. Outside of marketing, but thinking about sort of business and strategy, what are some of the challenges that you've encountered along the way?
I think my biggest challenge has been, how do we afford these physios? How do we afford these multidisciplinary programs? Where's the funding and that people can access? In Australia, we've got a public and private system that does deliver really good health outcomes when you compare us to other countries. But especially for medicine and nursing, there's a lot of great funding in Medicare and in our hospitals. When it comes to allied health, which are the non-medical nursing disciplines that work in health, we don't have the same funding supports. So when an older person who has had a fall goes to see their GP, and the GP does a really comprehensive medical assessment, adapts their medical intervention, they might go see a pharmacist to update their pharmacology, their medications. But then the GP goes, well, you need to go see a physio. And there's very few funded programs out there. In Medicare, there is a little bit of funding for physio, but it's only 4 to 5 sessions a year, and it doesn't pay the full price of a physio session. And it's not enough. 4 to 5 sessions a year really doesn't cut it in a fall prevention program. Yeah. So the biggest challenge I've always had is funding. And what we've seen in residential aged care, we saw the introduction of funding for allied health. And then 5 years ago, the government took it away in nursing homes. Recently, we've seen the introduction of restorative care programs in the new supported home, which is great. But we're going to have 1.5 million older people needing supported home, and the government's only allocated 20,000 packages per year. So it's not enough.
No.
So I think that's why the other third of my career from being a clinician, going into research and then going to advocacy is sort of, they all work together, because I get the opportunity to talk to insurers, government, health leaders and say, if you want to reduce falls, we need funding. Older people need funding to get access to this. And just while I'm at it,
please,
if you're over the age of 65, 1 in 3 people will fall each year. If you have cognitive impairment and dementia, 1 in 2 fall each year. And we're having now about 6,000 people each year dying of a fall, which is way more than car accidents. Yet there's no public education around fall prevention. There's very limited funding for treatments. So we've got a lot to do in the healthcare advocacy community to get government to support programs.
Talking on advocacy and this role that you play as, the national president of the Australian Physiotherapy Association, and you've talked about, how our healthcare systems are under pressure. Where do you see the greatest opportunities for innovation, and particularly talking about equitable access to physiotherapy services for older Australians?
Well, I think number one, we need a national education program so that people understand that falls are preventable. So it's not an inevitable part of getting older. And there is a bit of a negative bias in the community, you get older, you fall. And that's the wrong message. And we need government support, like a slip, slop, slap campaign, or a be in it for life like Norm back in the 80s. We do need a campaign saying this is achievable. I think that technology is going to play a lot. I just did some research recently just investigating the use of Fitbits with older people. Okay. Do they like using Fitbits to monitor their steps and their walking, to do more? And just like younger people, older people loved having a Fitbit, love seeing their rewards be measured. So I think technology is going to play a role. Again, technology is not cheap. So how do we get affordable tech to support people? But the reality is, as the world progresses, technology is going to become more and more part of our toolkit in healthcare, as a physio in particular. And that's, you look at fall prevention exercise and the TopUp website. We've got to deliver just projects and programs that are accessible and affordable, and because the reach of those tech programs are huge, and how we get involvement of professionals like physios in at the right time and fund that's important too. But I think we've got to be realistic. Not everybody, we cannot afford to give physio every week for everyone for the rest of their lives. So we've got to understand, when does that tailored intervention get added to the mix, and then just that general education around general exercise and fall prevention exercise in particular, supported by tech, is a great place to start.
Yeah, couldn't agree more. I also just wanted to touch on behaviour change and what you've learned about behaviour change and engagement with working with older Australians.
Look, it's one of my steepest learning curves. I remember being at university as an undergrad talking about psychology, and back in the 90s, we just learned about the history of psychology. It wasn't very practical. And I thought that I would learn on how to teach people to change their habits quickly and effectively, so that I give them advice and they go, yeah, sure, I'll do that. And I suddenly realized as a new grad, that does not happen. And so it's almost like us physios need to become mini psychologists. We've got to understand each individual, where their barriers to change are. And it's a huge growth area for your education. I wish the training I've had recently during my PhD on behaviour change I had as a parent. I would have been a much better parent on creating behaviour change in my children in a positive way, in a more efficient and effective way. Behaviour change is essential to everything we do. Habits are habits because we've just done them a lot and it feels normal. From a physio point of view, we talk about posture and movement, and somebody goes, but this feels normal. And I go, yes, it feels normal because that's what you've always done, or you've done a lot of it lately, but it's not good for your body. It's not good for your neck to always sit there on your phone with your head down and your neck forward. Yes, it feels normal, but I need you to do these exercises and I need you to change the way you do things so that your new normal, your new behaviour supports your spine, supports your neck, and stops you having pain. So behaviour change is essential. And that's where the marketing expertise that Juntos gave me in designing the website, right from the moment somebody sees TopUp, it's the logo, it's the words. I want it to be warm and inviting. I don't want it to be overly clinical or bossy. It needs to be something that somebody wants to click on and explore. Even the words we use, I don't want it to sound like I'm giving a speech at a university. I want it to be, oh, wow, this is possible. This is something you can achieve. It doesn't take a lot of effort. It does take some effort. But, and that's where marketers are really valuable. They give us clinicians and researchers, they strip our language back to language that appeals to everybody. And stops those barriers. Once you know a lot of words around something, you want to use them again, and then you've suddenly got to take those words away. And that's where so just behaviour change starts with how somebody feels with any interaction, and it has to be positive. If it's negative, you disengage, you've lost your connection with that patient to help them achieve what they want to do, which is to have a better quality of life.
Yeah, ultimately, yeah, better quality of life. Well, this brings me to my last question, Rik. If we were having this conversation in 5 years' time, what would you hope had changed in the way health research is commercialised and implemented?
What I would want to see is technology programs that have strong evidence base, so that we researchers and clinicians can put it out to the community and say, hand on heart, this works for these people, and not overgeneralize or overpromise, but we need to be able to stand behind it and say, this is going to make a difference in a certain parts of our population. I would like it to be funded so that people can find it easy to access. At the moment, TopUp, there's a cost associated with it because I've got no funding, but it would be great that Medicare could start thinking about funding technology as well as medical care, because I think they're going to go hand in hand. Me personally, I would love to see TopUp translated into lots of different languages, because in Australia we are a multicultural society, and I've got it in English and Mandarin and Cantonese, but I would love in 5 years' time to have an Arabic version, a Vietnamese version, a Spanish version, and I'm about to do a Portuguese version in Brazil. But it's not just translating the words into the language, it's making sure that the program meets the cultural fit of all these different cultures, because we're all unique and our cultures are unique. So that's probably enough to say where I want to achieve in 5 years, and then I might retire.
Wow, what an incredible journey you've had, and it sounds like a journey to come as well. It's been really,
it is.
Yeah, it sounds like it's been very purpose-driven, and you can hear your motivation and the passion that you have for the work that you do. It's very inspiring.
Oh, well, thank you for this opportunity to talk to you. I want to say thanks to Juntos for teaching me a little bit more about marketing. But also, I've worked with a lot of older people over the years to design TopUp, and all of them have influenced what we see today. So I want to say thanks to all those patients of mine.
Oh, thanks, Rik. And if people want to find out more about, maybe TopUp or, other ventures and initiatives that you're a part of, is there somewhere you'd like to point them in the direction of?
Yeah, what they can do is people can just Google me on www.topupexercise.com.au, and TopUp Exercise is all lowercase, one word, but they can just Google Rik Dawson at the University of Sydney and you'll find my research. I'm all over social media, so I just think Google Rik, which is R-I-K, and Dawson, D-A-W-S-O-N.
Beautiful. Thank you, Rik. Thank you for your time. It's been a wonderful chat.
Hey, thanks, Leah. Thanks all.